This is our case presentation.
Presented by Garrison Greist.
Sam Palmentier.
Samantha Thorson.
And Ruth Tillahan.
So for the description of the patient and the reason for encounter, the patient is a 46-year-old male. He has been experiencing pain from his arthritis for the past month. He recently started taking glucosamine about a week ago, but his pain is still at a 4 out of 10. He is in the pharmacy today looking for a recommendation, wondering if he should increase his glucosamine dose or if there's anything else he can take to relieve his pain. The marital status, family support, employment, insurance status, and special needs are unknown at this time. He did not state any known drug allergies or adverse reactions, and there was no information given regarding his immunization status. Lab values and physical assessment measurements were not available at this time, and the patient did not state anything about a social drug use, including caffeine, tobacco, alcohol, and/or recreational drug use, and the patient shows no reason for not being able to follow the new therapeutic plan. As for past medical history, he does have a history of GI ulcers, but he said he has not experienced any symptoms with those recently, and he has no other health conditions.
His current medication list includes glucosamine hydrochloride 500 milligrams. The dosage form is unknown, and it's used to treat his arthritis. He takes one by mouth 3 times daily, which was started about a week ago. Patient states still having pain from the arthritis and is experiencing no side effects with the medication.
For the patient's review of system, the patient states having joint pain on a scale of 4 out of 10, and a more extensive review of systems can be assessed the next time that we meet with the patient.
Goals of therapy and drug therapy problem. Patient's indication is arthritis. Goals of therapy for short term would be reducing the number of days that the patient experienced pain from arthritis within 5 days. A long-term goal would be eliminating the pain from arthritis within 5 weeks. Drug therapy problem is regarding indication since the patient is experiencing pain from arthritis while taking glucosamine hydrochloride 500 milligrams. So it would be stated as patient has been taking glucosamine hydrochloride 500 milligrams for his arthritis pain and needs additional drug therapy for continued pain that is still 4 to 10. Therapeutic options, we have 2 options, pharmacological options and non-pharmacological interventions. For pharmacological options, we're picking acetaminophen 500 milligram tablet for his pain. For non-pharmacological interventions, patients should exercise followed by applying ice to affected joints about 10 to 15 minutes on at least 1 hour off between application with barrier between ice and skin. Weight reduction and also physical therapy.
So the plan for the man was to have him continue taking the glucosamine hydrochloride 500 milligrams as he's been taking it, which is the 500 milligram by mouth 3 times daily for the arthritis. He was counseled on the fact that the medication could take up to 6 weeks for full effect, and that he only been taking the medication for about a week. He was counseled on if he was experiencing any severe side effects, including profuse vomiting, diarrhea, and severe abdominal pain, to stop the medication and call your doctor or pharmacist. And the rationale to healthcare provider, patient was told to continue the medication, reports no side effects. Patient was counseled on the medication could take up to 6 weeks to become fully effective. And clinical studies show no additional therapeutic benefit for dose above 1,500 milligrams for this medication. So the patient was told to continue to take the 1,500 milligrams within 24 hours. Then we decided to add the acetaminophen 500 milligram tablets for the pain. The directions were to take 2 tablets by mouth every 6 hours as needed for pain. Max of 6 tablets or 3,000 milligrams per 24 hours, or 2 tablets or 1,000 milligrams in a single dose. Patient was told to start taking the medication right away and expected to work in about an hour. Patient was told to take the medication with a full glass of water and avoid other products containing acetaminophen. Alcohol was also told to be avoided while taking the acetaminophen. some common side effects for the patient was nausea, constipation, and vomiting. Some severe side effects included the yellowish skin or yellow in the whites of the eye. Patient was told to contact your doctor or pharmacist if you're experiencing any side effects and told to stop the medication. And the rationale behind recommending the acetaminophen was the patient was advised to take it with the glucosamine to help with the pain until you see that full effect from the glucosamine. Patient was counseled on onset, side effects, and how to take the medication. And acetaminophen was recommended over an NSAID based off the patient's history with GI ulcers.
The follow-up plan that's been put forward, our first follow-up date will be 5 days out from when the patient came in. This is to test for the efficacy and safety of the acetaminophen to help relieve those pain symptoms until the glucosamine kicks in. This can be done over the phone. If the patient requests, it could also be done in person. Our second follow-up is 5 weeks from today. That's because the glucosamine was taken for a week previously, and it can take up to 6 weeks to have begin being effective. This again will be done over the phone over phone. Monitoring parameters for the acetaminophen. So what we're looking for, especially in that first 5 days, some safety adverse effects. We have itchiness, constipation, nausea, vomiting, headache, insomnia, and agitation. There are more severe reactions that we should look out for. These can include collapsing lungs, skin reactions, liver failure, and inflammation of lung tissue. For efficacy, we want to see how well the acetaminophen improves that 4 out of 10 pain scale that the patient reported. And then for glucosamine, the side effects we're looking for that second date is swelling, increased heart rate, constipation, diarrhea, vomiting, nausea, headache, indigestion, and as well as any changes to ability to sleep or sleep-wake cycle. For the efficacy, we're looking for improvements in the range of motion, joint function, and mobility for any affected joints.